Behind me is the Ethos linear accelerator that we use to deliver the adaptive radiation therapy.
So the Ethos brings us new technology that we don't have currently on our other machines or on our more conventional, traditional machines.
Adaptive radiation therapy allows us to give more radiation or more targeted radiation dose to the tumor while better sparing the normal anatomy that's nearby.
The patient will do the same thing, they will see the same thing, and it won't seem any different for them.
So we bring the patient in the room, we position them on the table how we need them positioned. Every patient has their own kind of unique setup for their specific treatment area.
At the time, the initial imaging, patient may have an empty stomach. When patient comes in, may have a full stomach. And then that full stomach can push the organ closer to the tumor.
And so we adapt to the patient. So we take that plan and we adapt to how they are today. In the console room, a large time commitment was always outlining any structures in a patient's body. We call it contouring.
The radiation planning software cannot necessarily identify what is a normal anatomy versus tumor. And somebody would have to go in and delineate, so this is bladder, this is rectum, this is tumor area you're treating. Previously, the patient would have to sit on the machine during the time, like myself, would have to go and individually do that.
Now, with the use of AI, we're able to have the AI do the bulk of that contouring. We're able to quickly re-optimize, we say, the patient's plan.
It takes all that manpower that previously would have had done to delineate all that stuff and able to do it in very few minutes.
As a physicist, we are doing the quality control or quality assurance. So we try to make sure that the AI contours are correct. When we do the adaptive treatment, we treat the patient on a day-to-day basis more accurately.
What it really does is it gives us more confidence in our ability to try new things. So if I was wanting to treat an area that would have been very challenging, very mobile, I have now faith I can actually hit that area or spare something that may have been very critical nearby, which also may had a variable position. This allows us to treat a high volume number of patients, which means quicker treatment times for patients, better imaging for patients. It's really uniquely suitable for tumors which are within the abdomen. For men, this would be bladder and prostates, or gynecological malignancies for women such as cervical and endometrial cancers.
The fact that we can bring this level of technology to Buffalo, New York to treat our patients at the highest level, this is the future. And I think this is really where radiation medicine is going.